Well, thanks again. Great success story, and we're happy to be able to, one, provide a token of appreciation for the principals and the teachers, but particularly here in Lakewood to highlight a great success story, and the effort has paid off, and it's integral for a lot of these kids' future. So thank you very much. Have time to take a couple questions before I get out of Dodge.
Governor, the White House now says that it will look to pay any of the superintendents or local school board members who defy your ban on mask mandates. Do you have a response?
So our view is, of course, that we believe this is a decision for the parent to make, just given the uncertainty about what it means, particularly for a lot of the young kids to be in that. And I think that's where the vast majority of the districts, I know we have, I think, two who are not providing the parents with the rights, but obviously we believe that the parent, rather than the government, should ultimately be able to make that decision. I'm not sure that they have the wherewithal. They're also talking about imposing a potential nationwide mask mandate on kindergartners, first graders, who knows, regardless of what the parents believe is in the best interest of their kids. And obviously, if you're talking about the federal government coming in and overruling parents in our communities, that would be something that we would fight back vociferously against. Yes, ma'am.
Governor, a father in Pasco County tells us his daughter was diagnosed with COVID last night after spending all day Monday in school with other kids. Those kids are now back in school. This little girl is not. But the school says they cannot notify parents until they get notification from the Department of Health or a doctor's note. This circumstance will likely happen again at some point this school year. Just wondering how parents are supposed to make informed decisions about the safety of their children.
Well, I think we've had a year of this where obviously if people are sick, the school districts are doing the right thing and sending them home. And of course, if somebody tests positive today, they obviously got infected before school started. So I don't think you could attribute that to being in school. And I think what we found, fortunately, is there's actually was higher infection rates when you're just in the community versus when you're in the classroom, particularly for the younger kids. These kindergartners and first graders, they're not people that are really transmitting this in significant levels. So that's something that's very important in terms of looking at how that's being done. And then, of course, one good thing this year, last year, we didn't have any vaccines available. We didn't have any real effective therapeutics until the winter. We now have Regeneron, which we're going to talk more about because I think that's been very successful, but I think it's underutilized. And so we feel like we're in much better posture. And so I think what they do is just do what they've been doing. And if there's somebody that's sick, stay home. I don't think, though, we want them sending home students who maybe just had a glancing contact in the hallway with somebody, which is what, when the schools first started last year, there were some school districts in Georgia, if someone had tested positive, they would find anyone that was ever in the same vicinity, the same room almost, would get sent home. We don't think that that's the way to go, but we trust the school districts to basically follow similar to what they've been doing.
Governor, we know that pediatric cases are on the rise. Will the state be keeping track of the COVID cases in school and then producing that data on a regular basis?
I have to ask the Department of Health in terms of are they going to do school-based. I know they did last year for most of it. One thing I think is important to point out about the pediatrics, because, look, we saw this last year when school was coming in. There was a lot of things put out, and I think sometimes there's agendas at play or whatnot. So what we have in Florida is we have about 1.3% of the COVID-positive patients that are hospitalized are pediatric cases. And for the whole pandemic, we've been between 1.1 and 1.4% of the census on any given time has been pediatrics. So there's been no change in the proportion of pediatric patients who are COVID positive. Now, obviously, we have more people that are COVID positive in hospitals than we did 6 weeks ago. And so the raw numbers are increased for everybody, but there's not been an increase in the proportion. And I think that's important to point out because some people, you hear a lot of stuff, does Delta behave differently vis-a-vis kids than the previous iterations, which fortunately have a very minor impact, particularly on young kids. And the answer is, in terms of the hospitalization percentage, we've not seen any change in that in Florida. Clearly, we're at the top of a wave here, so you're going to see more cases and infections diagnosed. It's also important to point out that of the COVID-positive patients in hospitals, about 25% on average are not being treated for COVID. In other words, everyone gets tested who goes in, and if you're positive and you have a different procedure, you should classify it as COVID positive patient because they want to isolate and make sure you're not spreading it. Pediatrics, depending on the hospital, it's typically between 20 and 40% pediatric COVID positive inpatients are incidentally COVID positive. In other words, they're there for a different reason. They get tested when they come in, and then they happen to test positive for that, but they're not being treated for COVID. Also, I would point out there has been an increase in pediatric respiratory virus admissions over the last really many months, and a lot of that is attributed to the resurgence in RSV. And so that's something just, as a parent, I have young kids. COVID I view as a very minor risk. RSV is a little more serious, and it just shows kind of certain things that are focused on versus not. I've had doctors tell me that parents have come in with kids who are sick. They've gotten a negative COVID test and a positive RSV, and the parents were relieved at that. That's the opposite, because RSV is something that we think RSV has peaked in Florida. If you look at it, is trending down, but RSV was very modest when last year with COVID, and whether that's viral interference or whatever you want to attribute to, but it's been much higher levels throughout the whole country there. And so when you see pediatric admissions, some of them may be COVID positive or suspected COVID, and it may ultimately turn out that RSV is what they end up or being treated for. And again, we think that's peaked and is going down in Florida, but that is something that I would say, just as a parent of young kids, that's a much more significant risk, than COVID has proven to be. Okay, well, thanks everybody. We appreciate it. We'll see you guys soon.